Good evening, and thank you so much for joining us tonight, both here on Zoom and on Facebook Live. I'm Jen Mattoni, and I'm an outreach counselor with Mass Support Network, which provides free outreach, counseling, and resource referrals in response to the pandemic. 2020 has been unprecedented in so many ways, and the holidays this year will also be. Mass Support is thinking of the families who can't be together in person and the people who are living alone. We're also thinking about the families of the more than 10,000 people in Massachusetts who've died from COVID. We're deeply sorry for your losses. This year is surely bringing change and challenge for so many. So how can we still celebrate the holidays, stay safe, and make the season as meaningful as possible? That's what our panel is here to discuss tonight. So first, we'll hear from Nisha Puri, and then Wahida Saif, Robert Macy, and then Neil Boyd will close out the night. We want to say first that all opinions expressed tonight are those of our experts, and they do not represent positions of Mass Support Network. And we'll just go over a few housekeeping things before we get started. So you can enter questions into the Q&A, not into the chat, please. And the chat will contain resources and information about Mass Support and some other related resources. And if the panelist does ask you a question, you can put your answers into the chat. And for those watching on Facebook Live, of course, you can enter your own questions and comments via Facebook. And now I will introduce Nisha Puri. We can advanced slides. Thank you so much. Okay, so Nisha Puri is a graduate student at the BU School of Public Health, where she's pursuing her master's in epidemiology and biostatistics with an emphasis in infectious disease. Thank you so much, Nisha.
Thank you so much, Jen, for that lovely introduction. So hi, everyone. Thank you so much for being here, and I'm very excited to be here as well. Today, I'll be going over some safe holiday frequently asked questions, as well as recommendations from the healthcare professionals and the epidemiologists out there that are studying COVID-19 that have been brought to you by myself as part of the Boston University COVID-19 core. So next slide, please, Nick. Thank you. So today's presentation will cover some infectious disease terminology, very basic, just to help us as the general public understand exactly what the data that's out there means and what's really going on out there. I'll also be discussing a little bit more detail about how COVID-19 spreads and how that spread has transformed the state of science today, including current statistics, current recommendations that reflect the latest CDC briefing that was held today. And how these recommendations work and why we should think about implementing them, especially as the cases rise and especially as our holidays come near. I'll also go over the top 10 safe holiday FAQs, as I mentioned earlier, from a listicle that the BU COVID Core has put together, which is pictured to the right on my slide with a link below. And then I'll touch on some Massachusetts state policy, as well as what the COVID Core is and what we do, just to bring it all together. Next slide, please. So I'll start off with some brief infectious disease terminology. And the reason that I think this is important is because what's been said since the start of March and really since the start of this pandemic has begun is that we're really undergoing two pandemics, which is COVID-19 and the spread of misinformation. So there's a lot of misinformation out there from different resources, and it can get a bit overwhelming as far as what these numbers mean and why they're significant. So I wanted to go over some basic terminology that would help with the rest of this presentation, as well as later on when we're reading, research articles or watching the news and really trying to interpret what all of that information means. So some quick background, I'll begin with the virus versus the disease. So as we know, we've heard SARS-CoV-2, COVID-19, COVID, coronavirus, but officially, so SARS-CoV-2 is the strain of the virus specifically that causes the disease COVID-19. And we're in a pandemic, which means that the virus is spread at a global rate as well as a very alarming, significant rate as far as cases and deaths go. Now, when we talk about viruses, we talk about certain characteristics that make them dangerous or not. And so down here, I have some terms that are related to SARS-CoV-2. So when we look at the infectivity of a virus, that means whether or not the virus can cause an infection. And this is important because this correlates to whether or not the virus is contagious or can spread person to person. So as far as SARS-CoV-2, we know that human-to-human transmission is possible because you can catch it from somebody else. And we also know that it spreads very quickly. And we also know that people who are asymptomatic or people who don't exhibit symptoms can also spread the virus. Then we look at the pathogenicity. So that just means whether or not the virus can cause disease. Then based on whether or not it causes disease, we look at the virulence, which measures how severe the disease is. So the disease being COVID-19, and we've seen that it can go from very mild symptoms, very mild clinical manifestations to very severe illnesses where people are put on ventilators in the hospital, or they have residual outcomes after infection, as well as how many people have died because of this disease. So now related to the disease itself, COVID-19, these three terminologies or vocabulary words, well, they're very basic in epidemiology, are really important because they help us understand how the disease is spreading and how prevalent it is out there. So I'll start with incidence, which is the number of new cases in the population. So when we talk about how many diseases have come up in 24 hours, that's the incidence within a 24-hour period within a certain population. So we talk about how much is going on in the United States within the past 24 hours versus how much is going on in certain states, that's the incidence. The prevalence is the number of total cases there are within a population over a certain period of time. So if we're talking about total number of cases, which is what we usually see as a tagline in news articles or in the news itself on TV, it's typically the prevalence, which is how many cumulative cases there are. And then we have mortality rate, which is how many people have died because of the illness. So next slide, please. So now I'll talk a little bit about how COVID-19 spreads, and I have a timeline to the right that kind of demonstrates exactly the timeline of when a person gets infected versus when they start exhibiting symptoms versus how long they're infectious for, which again goes back to the infectivity that we talked about previously, and then how long it typically lasts. So as we know by now, the CDC has stated that COVID-19 spreads via respiratory droplets or small particles, which we call aerosols, that are produced when somebody sneezes, coughs, even sings, talks, or even breathes if they're close to you. That's why we really recommend that general 6 feet apart in order to prevent those respiratory droplets or aerosols coming to somebody as much as possible. It's also been proven that it spreads through touching commonly used surfaces. In general, indoor environments without good ventilation increase the risk because there's been a lot of evidence that states that COVID-19 droplets can hang in the air, and if you're not ventilating the area or if you're not allowing new air in, then it's possible that you could breathe in the air that has the droplets and thus get infected. And then there's something called community spread. So there's a lot of evidence that states that COVID-19 seems to be spreading easily and sustainably in the community. So that means that within a population of people, it's been proven that it can spread throughout that way. So community spread is exactly how it sounds. And then I'll draw your attention a little bit to the right, to the graphic where we see that there's a large incubation period where somebody is infected and they can be asymptomatic, but the virus is still in them and it can potentially cause disease or not. So again, that infectivity. Then they can start exhibiting symptoms and then they can start passing it on to other people. And then we have where it starts mild illness versus severe illness or the infectious period. So next slide, please. So now I'll talk a little bit more about our mitigation terminology. So I know that we hear a lot of different words being thrown out, like what's social distancing and what's quarantine and what's isolation, and maybe how do we properly adhere to those different 3 levels of mitigation. So I have another graphic to the right that is taken from Insider Magazine, Lopez 2020, and it really clearly outlines who should be social distancing, who should be quarantining, and who should be isolating. But I will draw our attention to quarantine and isolation specifically, because with the holidays coming up, and especially in light of today's CDC briefing, they talk a lot about when to quarantine versus when to self-isolate. So quarantining is typically recommended for people who maybe haven't been exposed to the, or have been exposed to the virus. I'm sorry, they've been exposed to the virus, but they don't have symptoms necessarily. So it's for a minimum of 14 days. And what you can do during quarantine is, so you can stay in a room alone if you live with people, a house, you can have friends, family, or delivery service drop off supplies, but avoid touching them. So that contactless delivery that we hear a lot about, it's recommended that you can stock up on food and water, just so you can limit the interactions that you have throughout the quarantine process. And it's really recommended that you don't leave your house aside from emergencies, because again, you can, shed if you are infected with the virus. Self-isolation is for people who think they have the virus, or for those who have tested positive for the virus. So that means it has to be no direct contact as much as possible. It's really recommended that you stay in a room, and you can really, again, can't leave the house aside from emergencies. So that sheds a little bit of light as far as who should quarantine versus who should isolate. And then to touch on social distancing, it's really for people who haven't been exposed to the virus, but you have a little bit more freedom as far as like interacting with roommates and family members that you live with. You can go outside, whereas in quarantine and self-isolation, it's really not recommended that you go outside, because you can still have that chance of shedding the virus to somebody else. So next slide, please. So now I'll just go over some quick statistics. To the right, I have the map of the COVID tracker from the New York Times, which has been a very up-to-date resource as far as tracking cases and population density. So as of November 18th, which was yesterday at 8 a.m., about 1,583 deaths occurred within the past 24 hours. We have a total of 159,508 new cases across the United States within 24 hours. And then cumulatively, so since March, we have about 11,439,000 cumulative cases and 248,400 cumulative deaths since March. So next slide, please. So that was all a quick background as far as, what is COVID and how does it transmit to people and how severe it is. So we know really what we've been knowing since March is that it is serious and it travels fast, and it's really not going anywhere right now. So as of today, the CDC's incident manager, Dr. Walk, has advised against traveling, especially in the light of Thanksgiving holiday coming up. So the CDC has released a checklist that is very intensive, and I wanted to go over it a little bit as far as if you've answered yes to any of those questions, then you should consider an alternative holiday activity, especially because they've officially advised against traveling for holidays. So if someone or in your household or yourself will be visiting somebody with an increased risk of getting very sick from COVID-19, then you should consider an alternative activity. If there are an increased case count in the community or the destination, then you should check the COVID tracker for how severe it is, but it's also recommended that you really avoid travel to that area. If hospitals in the community or destination are overwhelmed with patients with COVID-19, if the home or destination has requirements or restriction for travelers, and if 14 days before travel, if you have, or those visiting you have had close contact with people that they don't live with, if you're traveling by bus, train, or air, that makes staying 6 feet apart, social distancing difficult. And if you're traveling with people who don't live with you, it's really recommended that you partake in an alternative holiday activity. So next slide, please. So the CDC also has released a list of recommendations, which include washing hands often, avoiding close contact, so again, that 6 to 12 feet distance, wearing an effective mask, covering coughs and sneezes, so practicing proper hygiene, cleaning and disinfecting commonly touched surfaces. So something that was brought up today in the CDC briefing was that rather than sharing utensils, you bring your own if you're going to have a meal, or if you're going to go into a food station, you could, or if you're going to share a meal with somebody, bring your own food so that way you don't have to go into their food station. Another thing is monitoring your symptoms. So again, if you exhibit symptoms, to just be wary of that and search an alternative activity. Next slide, please. So I'll go over some alternatives that a lot of the CDC has also released as of today for holiday gatherings. The biggest and most safest choice is to celebrate virtually or with the people that you live with. So we hear talk about, staying in your bubbles for Thanksgiving, and that's, if you live with roommates, that would be your roommates. If you live with family, that would be your family. But really, if you're planning on gathering with, it's really recommended against gathering from people outside of your house or outside of your bubble. But there are also some great alternatives. So you could watch TV and play games with people in your household rather than throwing that traditional Thanksgiving party. You could watch the parades, although I'm not sure that there is one this year. Sports or movies at home. Any other fun game to play with. Also shopping online specifically after Thanksgiving and the days leading up to winter. You can use contactless services or contactless delivery, like I mentioned before, for purchase items, or if you're social distancing, a curbside pickup is okay. If you have to go in person, open air markets and staying at least 6 feet away from other shoppers while wearing a mask is probably the safest way to do it. Preparing traditional dishes safely and then delivering them to your family or friends in a contactless way rather than having the meal itself. That way you can sort of share a meal, you share that home cooked shared experience with the food, but you're not necessarily in each other's presence, which decreases that risk of transmission. Or participating in a gratitude activity, like writing down things that you're thankful for and sharing it with your friends and family through a virtual connection. So next slide, please. So I wanted to go over this graphic a little bit as far as how these mitigation strategies work and why we should really think about implementing them. And Ian McKay, who is a PhD candidate on Twitter, especially epidemiology Twitter, tweeted out this picture, and I thought that it was so relevant, and it's a very general but also simplified way in demonstrating why we want to implement multiple mitigation strategies and how they work. So we can think of each mitigation strategy as a slice of Swiss cheese. And we all know that Swiss cheese comes with a bunch of holes, but the more slices you stack up on one another, the less holes that are present, right? And so we recognize that no single intervention is an end all or 100% protection. So if you go outside and you wear a mask, that's not 100% protection against transmission. You can go outside and wear a mask and then also socially distance, so stay 6 feet apart. And then you can also be outside where there's open air and you don't have to worry about the lack of ventilation. And then you can also limit your time because that also decreases your risk of transmission. So it's just layering as many mitigation strategies on top of one another as possible that's going to lead you to be the safest that you can be. And really each intervention has, imperfections, like we said, the holes, but implementing one or more of them on top of another is what leads to a higher success rate. What's also interesting about this graphic is that there are personal responsibilities versus shared responsibilities. So we know that there's a lot of talk with the vaccine coming out, and we know that there's a lot of talk with herd immunity and how that can be achieved. So that would rely on one of the shared responsibilities is, quarantining and isolating if you are positive, because that really prevents the spread from others. That's a shared responsibility that we have to our community members. Taking a vaccine to help boost herd immunity, especially for those who can't necessarily, is a shared responsibility that would help the community and others. Taking tests, staying outdoors, all of that can be counted as a shared responsibility. So this is a good way to think about how these mitigation strategies work, why we have to layer them on top of one another, and then why we should think about implementing them at all, especially this holiday season, because something big about public health is really harm reduction, rather than completely trying to avoid everything. So next slide, please. So now I'll quickly go over the top 10 safe holiday frequently asked questions. Like I mentioned, this is all from a listicle that the COVID Core Safe Holiday team has put together previously. So I wanted to take the most relevant ones and summarize them for the general audience. So next slide, please. So the biggest question we got was, are the holidays canceled this year? And they will look different. So it's really, again, the CDC today has just released a statement that it's heavily recommended against traveling and having a virtual Thanksgiving this year. So that doesn't necessarily mean that you can't celebrate Thanksgiving, but it's just going to look different. So there are plenty of alternative activities to go through. There are plenty of alternative ways to stay safe. And it's just really recommended that, it's taken seriously. And so maybe celebrating it in a different way this year, but it's not necessarily canceled. I mean, the spirit is still there. It's just celebrated and manifested in a different way. So next slide, please. So how to have a safer COVID holiday. There's a couple things, like I had mentioned previously, the CDC had released that checklist, but a couple more questions that you can really ask yourself before figuring out your holiday plans are, who's going to be there people-wise, to definitely prioritize your household, your pod or your bubble, so that's people that you've been in contact with regularly. Avoid strangers and keep the total number of people as low as possible. Think about the place where it will be. Will it be indoors with good ventilation? Will it be outdoors, which is a lot safer than indoors? Will it be in a small place that doesn't really allow for social distancing, stuff like that? So another thing is time, which is how much time you'll be spending with them. Obviously, the shorter amount of time is more preferred. And then space, like I mentioned before, how much space is available at the destination. Can you stay 6 feet apart, or is it not really permissible in that space? So next slide, please. Again, who needs to take special precautions around the holidays? We really all do. And that goes back to that figure with shared versus individual responsibilities. But really, it's been known by the CDC that people who are older, those who are immunocompromised, and then people who are on the front lines, like our healthcare workers or other people who are working right now in public or other frontline workers, they're at a higher risk for COVID and they may not be able to participate in group events. So you can help stay connected by incorporating those alternative activities so that we all take it seriously. Next slide, please. So again, masks, it's a very effective mitigation method and a harm reduction method, but we know that we can't necessarily eat with them on. So how to minimize the risk with masks when sharing holiday meals. So like I said, we can't really eat, with masks on. And if you are planning a meal with guests, you might want to replace masks with physical distancing. So maybe sitting every other seat, maybe setting up multiple tables so that way people can stay in their pods. That way when they take their masks off to eat, they're still in their pods. Even better is to have an outdoor gathering with good ventilation and also socially distanced, because again, that layers, more than one mitigation strategy on top of one another. Again, it's important to remember that shared objects can transmit the virus as well. So if you are going to share a meal with somebody else, make sure to, really bring your own utensils or maybe even cook your own meal. And that way you have that experience of sharing a meal without transmitting and without sharing anything, that would increase spread. Next slide, please. So then fifth question is, what precautions should I take to make indoor events safer? And I'll draw your attention here to a PDF that the COVID Core has created that really outlines which spaces are at higher risk, how to minimize the risk at home, and different mitigation strategies. And the PDF will be available, I think, after the town hall today. But just some strategies are really making sure that everything is well ventilated, making sure that you can physically distance within the home, making sure that you wear your mask, making sure that you practice good hygiene. So if you're going to sneeze or cough, make sure that you cover that with a vampire cough, or cough into your elbows, as however it's known to you. Sanitizing commonly used surfaces or commonly used objects are also very big, and monitoring your symptoms. So again, as the briefing today had described, if you are exhibiting symptoms, or if you believe you've been exposed or believe you're exhibiting symptoms, it's best not to go. So next slide, please. What precautions can I take to make outdoor events safer? So I know that outdoor events maybe are not necessarily as conducive this time of year, especially in Massachusetts, where it can be snowing or raining, and it's very cold weather outside. So it's also important to remember that masks are still required when you're outdoors, because again, it's layering strategy on top of strategy to ensure that all those holes in that slice of cheese are covered. But also distancing, and you can also bring heaters, you can bring warm drinks or blankets if you're going to have an outdoor event, or if you're going to attend an outdoor event. Next slide, please. So this one was really big, is how to talk to my friends and family members about COVID in the holidays. So it's important to recognize that it is difficult. This is difficult because there's a lot of things that factor into the holidays. This is a very special time for people, especially with everything that's gone on this year. A lot of people are looking forward to gather with their loved ones, but we do have to remember to be safe. So if you are having a difficult time, talking to your loved ones, just remember that not everybody feels comfortable gathering this year, to keep an open mind and open dialogue. Something that's come up also is that if you absolutely will be gathering with people, you could also have a designated party goer. So you could have, a group of people, or maybe yourself as somebody who makes sure that all those mitigation strategies are really being implemented, and somebody or a group of people to watch. You could even, kind of make a game out of it. Like if somebody, doesn't adhere to one of the mitigation strategies, then they'll have to do something. But it can be an opportunity to really, turn the holidays, and again, it'll look different, but to ensure that everyone is included, and to ensure that everybody is taking it seriously, and all those harm reduction strategies are in place. So next slide, please. So another question was, if I plan to travel for the holidays, when should I get tested and when should I quarantine? I have a figure to the right that again outlines, when exposure occurs and when you can get tested, and what all that means. But ideally, you would quarantine upon arrival to your destination and then get tested 2 to 4 days later. But you would also have to complete the 14-day full quarantine. And so whether you you can quarantine ahead of time. At your destination, prioritize outdoor activities, wear the mask, prioritize good ventilation indoors, wash your hands often, and keep your distance from one another. But again, I do have to stress that the CDC has advised against traveling. So it's really important that we remember that. Next slide, please. So do I have to quarantine even if I'm not traveling? Yes. So if you are going to have people come over, anyone that feels sick, or anyone that believes that they've been exposed, should have that 14-day quarantine. Consider getting a COVID test, and consider having that alternative virtual celebration, because that's all going to minimize the chances of anyone who attends getting the infection. Next slide, please. So how do I maximize safety while traveling? Again, the CDC has really recommended against traveling, but if it is absolutely imperative that you travel, harm reduction is the safest method. And so the graphic to the right from my mentor, Dr. Murray from Vox, has outlined which activities have the lowest versus the highest risk. So again, we have home alone or with the housemates being your lowest risk, and then indoor gatherings being your highest risk. For any settings, again, the same rules apply. Wearing a mask, washing your hands, avoiding crowds, avoiding close contact, and as much as you can, avoiding indoor spaces. But it's also been stated from the CDC that airplanes have the highest risk, whereas buses or trains have moderate risk and cars or RVs have the lowest risk. So again, just evaluate your plans, evaluate yourself, and really try to adhere to those recommendations of not traveling if you can. Next slide, please. So I'll quickly touch on Massachusetts state policy for Governor Baker. So for gatherings issued by November 2nd this year, reduced gathering sizes. Indoor gatherings at private residences are limited to up to 10 people. Outdoor gatherings are limited to up to 25 people. And this limits gatherings on public spaces that are held at event venues. They stay the same. Requires that all gatherings, regardless of the size or location, end and disperse by 9:30 p.m. Travel issued since July 24th is that there's a mandatory 14-day quarantine for travelers arriving inside Massachusetts. And then for face coverings and masks issued as of November 2nd, all persons have to wear face mask or face covering in public places, even if they are able to maintain 6 feet of distance from others. So again, just remember that it's layering on top of layering for those mitigation strategies. And then again, recreation and beaches, those 2 orders, they're linked there in the blue, go over the guidelines for beaches as well as for other recreational outdoor areas. Next slide, please. So now I'll quickly go over who the BU COVID Corps is and exactly what we do, since all of this information was brought to you by the CDC as well as the BU COVID Corps. So next slide, please. So who we are a group of student faculty members as well as other epidemiologists and also across the nation, because we have some collaborations with the University of Miami's Miller School of Medicine. We have a couple collaborations with community partners such as Res2Med, which is a group of Indigenous medical students up in Oregon. And we have media content creators such as Mad Real Content that help us work to disseminate the information that we've collected through the COVID Corps out to the general public. So you can find us on these different sites. We have a website, we have an email, we have a Twitter account, and we also have a YouTube page that allows us, which is also showing our web series. So for anyone interested, we do have a holiday web series that's partnered specifically with Mad Real Content and featuring a video for Res2Med about how to practice safe holidays in the time of COVID, especially among racial minorities. So we have a Thanksgiving video coming up that features heavily Indigenous students. So that's the Res2Med. So if you're interested, you can check that out on our YouTube page. But I will conclude with that. So next slide, please. So thank you guys so much for listening. I know this was a long presentation and there was a lot of information, but I really hope you consider all of that and have a great #Happy COVID holidays. So thank you, everyone.
Thank you so much, Nisha, for all of that really important information. Okay, and next we'll hear from Wahida Saif. She is a licensed mental health counselor and the program coordinator for Riverside Trauma Center. She provides consultation after traumatic events and trainings on a range of issues. And I'll turn it over to Wahida.
Thank you so much. Okay, let's see, should have, there we go. So thank you so much. So I'm going to shift gears just a lot from Nisha's presentation and talk about grief around the holidays. And when I talk about grief, I just want to just frame that in, there's a lot of different types of grief as we go into the holiday season and really beyond, around the country, around our state, but really around the country. We have now been in some form of quarantine for a very, very long time. There's lots of jokes that, it's March, 13,000 or whatever, or 200 or whatever. But we say that in jest, but really that's, I think really indicative of how we are. That's a good pulse of the nation. That's really indicative of how we have been feeling. And, you know, there's this sense of weariness and loss and grief of, you know, many of us talk about sort of, you know, packing up and coming home, or picking up our kids, or the kids sort of being picked up from school and then just not going back in, or now that they are going back in, it just looks and feels very different than it did before. So when we are talking about grief, um, I'm going to be talking about grief in many different ways today, and not just grief in the way we relate it to loss of life, although I will sort of touch on that briefly, but grief as really a whole person response to the actual or threatened loss or separation from anything to which we're emotionally or psychologically attached. So anything that we feel emotionally attached to or psychologically attached to, and then we are separated from it, either actually separated from it or feel that we might be separated from it. And that is grief. When we feel a response to that, it can be a whole person response to that. And it can be a loss to death. It can be a loss to divorce or migration or separation from someone involuntarily. Sometimes we lose things inadvertently to natural disasters or fires. And right now we're feeling grief in ways because our important rituals have been interrupted by COVID. We saw, you know, I was saying that, you know, in March we sort of packed up and went home, and what that led to was really this loss of a lot of milestones that sort of happened in May and June, proms and graduations, and, you know, lots and lots of birthdays that happened. So, and people were incredibly creative, and we have to give lots of credit there. But there was still a huge sense of loss in ways that, you know, we you know, I waited all these years, you know, sometimes people, you know, or not sometimes people, you know, PhD programs that people work towards, or really, really other things that people really work towards, and then ended up getting their diplomas online. And that felt very different. Um, and people were able to find silver linings for that, but there was really a sense of loss and grief to that. So I'm going to speak the rest of the presentation really about grief in those terms. Um, so just briefly, though, I do want to talk about, because we have had so much death again, in our nation and in our state, that grief to death has also been interrupted and contorted in many ways in times of COVID. You know, funerals look different, mourning looks different. We have some examples here of how you may or may not be able to read it. So I'll read, you know, someone said that, you know, this is a Twitter sort of thing that someone said that she lost her dad to COVID and she can't see him. She had two choices, either direct burial or direct cremation. And I'm so angry. And my heart is aching for all those affected by this. And no one should have to die alone. No family should be kept from saying goodbye. And this is sort of a constant sort of refrain from people who have lost loved ones, who's, you know, we, in many, many different ways, people have talked about how they were just kept from being able to say goodbye, or when, you know, they were dropping off loved ones in ICUs, having to sort of rush and say goodbye there while their loved ones were still alive, because doctors were advising them that this might be the last time that they were in fact seeing their loved ones. So just grief has really just been changed in this time. The bottom picture is a Muslim sort of funeral that you see two men sort of praying over a body of a past person who's Muslim. And what the title sort of says is, I see that it's really blurry, is that they realize that they're not really sure that this person would get a proper Muslim burial because, again, the rituals have been so disrupted. And so they don't know this person, but they knew that he was Muslim, or they were Muslim. I'm not really sure of the gender. And they went ahead and just prayed over this person because they felt obligated to. So I just wanted to acknowledge that while we're not talking about death, that's still in the midst of all this death, all of those rituals are also interrupted. And the reason why I think this is really important to recognize is that as human beings, we do this really well. We do the rituals and the grieving process really well. We know how to do this piece really well, both for ourselves and for other human beings as well. We know how to show up for each other. We know how to bring the casseroles and how to sit shiva with people and how to show up at each other's homes and how to console people and how to do all of that. And that entire process for all the reasons around Nisha was mentioning around quarantine and not showing up and social distancing. And again, people have been really, really creative, but all of the natural ways and the used to ways have been really disrupted. So I just think it was important to mention that. But then coming back and stepping back into just the loss that we're feeling generally, and the grief that we are feeling generally, not to death, but just the loss of, what we know about, what people talk about in the world of grief as what we call the loss of the assumptive world, the world that we assumed would be there, the things that we take for granted, the beliefs that we had always had, the things that we thought would just always sort of be there. Without sort of thinking about them. Those were suddenly taken away from us. The invisible losses that are not often acknowledged by others. And they're not always realized. And so these losses are not always realized and recognized, even by us. So some of these things might be, the routines that you had in the morning, the grounding routines that you may have had, getting up in the morning, dropping off your kids to school, that coffee that you got on your way to work, all of those things sort of ground us. And those routines may no longer be there, and you might suddenly find yourself, in an unstructured day. You're at home, and now you're not getting your coffee till 11, or you're, suddenly it's noon, and you find yourself not having had breakfast, or whatever it is. And I'm using sort of silly examples, but that routine and structure is incredibly important. I was talking to someone who mentioned, I finally show up, everyone is working from home, but I finally show up to work, and my favorite coffee shop is closed due to COVID. That's like the one thing I could count on is closed too. And yes, in the big scheme of things, it's nothing, and it's still a loss. It's still a great, and it's like, that phrase of death by 1,000 paper cuts. It's sort of all of these losses and all of those things sort of start to pile up. But the loss of the assumptive world, all of those things that we take for granted that we just really thought would continue to be there and continue to be in our life and really, continue to ground us, start to slip away, and that structure and routine may start to crumble. But I just want to highlight and want you to think for yourself, what might have been those things that sort of kept you grounded, or sort of, were markers in your life or your day or your routine that may have sort of slid away, and maybe you didn't even realize it or didn't even recognize it. Some common bereavement reactions. There are many. So if you're sort of feeling ungrounded and unmoored and sort of, out there and listless, there's a reason for that. There are many, many ways to feel, many common reactions. I just want to point out the last two in particular, the physical problems, somatic complaints. If you are feeling not quite right in your body, there's a reason for that. And a lot of people are complaining about lots of physical aches and pains and ailments. There was a physician who was saying, she's seeing more and more people come in with just random sort of like this. People are just throwing out their backs more. And she's like, yeah, and that's because people are just getting so much less physical activity than they were before. You know, the walks to the car and the walks around, and this, all of that has sort of been taken away. So people are just complaining so much more about like the tweaks in their backs and things like that. This last one in particular, if you are finding yourself taking twice, 3 times as long to get the same amount of work done, welcome to the club, first. And the same sort of goes for the kids too. First of all, if you're working from home with kids, you know, the interruptions. Second of all, it's just, that is, you know, just again, a refrain that I'm at least hearing over and over again. And, you know, we can do a whole nother presentation on sort of cognitive load and how much more headspace many things tend to be taking right now in our head. I won't get into that right now. I don't have the time, but I do want to really just bring your attention to this aspect of, like, people are really struggling with, I am not as productive, I'm not getting the work done. It's just, it's like, you know, trudging through like, you know, sloth, you know, sludge. And that is true. It's not just you, it is people, everyone around you. It is really taking 2 or 3 times longer to get the same amount of work done. If you're not, don't feel as productive, it is not just you. It is, I think it is a particular feature of the pandemic, or being stuck in the pandemic, that adults and children alike are really having a hard time with that. We're hearing it from middle schoolers, we're hearing it from high schoolers, and the little ones are really struggling as well. And being, you know, the back to back Zoom calls. Someone called me on my phone, as opposed to, like, I was waiting for them on Zoom and they called me, and I was like, oh, we can still do real, just like phone calls without like a Zoom involved. And I like had forgotten we could still do that. So just throwing that out there. There's a real reason we're so fatigued. Couple of ways I want to talk to you about grief. And we talk about this when we talk about grief in relation to loss of life, but I think it still applies here. It's cyclical. So it feels like, you know, it goes in, like, if you're feeling some shock and numbness, some sort of, you know, I can't believe this is happening. And like, I sort of find myself waking up and being like, are we really in a pandemic? Like, is it like really? Are we in the plague? Like a real actual plague, like 1918 plague? Like, I still sometimes wake up and cannot believe that we're in a plague waiting for a vaccine, like, actually. And then there's some depression, like, real quickly that comes in after that. And then I'm like, okay, I guess that's where we are. And then you, like, you know, go through that again. So there's some, you know, and if you go through, you know, but don't think just because you come to some, like, yeah, this is where we are and this is the reality we live in, that you can't then again hit shock or numbness or some, like, you know, actual, like, I cannot believe this is where we are and I'm so darn upset about this, and hitting these reactions over and over again. That is how grief works. That is how the sense of loss works. So just offering that to you, that doesn't mean anything is wrong with you. That's how grief works. We generally tell people, you know, that, you know, and the problem with the pandemic is that we're still very much in the middle of it. It's not like, oh, the event ended and now we're moving through it. We are still very, very much in the thick of it. So timeline wise, it's not like, okay, and now we're moving towards some sort of I don't like to use the word resolution or closure or anything like that, but if you are feeling very much in a cycle, it's pretty normative, is what I want to tell you. It's pretty expected reactions. If it feels like it's crashing over you in waves, like you're fine, you're fine, you're fine, and then it hits you, that's really normal as well. So I just want to say that as well. So it can feel like it's sort of cyclical, or it can feel like it sort of comes in waves. Both of those things, again, very normal, very expected reactions. I just want to say just a couple of words on culture. We don't really have the time to do this justice, but death, grief, bereavement are incredibly personal experiences and are incredibly culturally bound. And when I say culture, I do mean culture by the ways that we tend to think about culture, certainly race and ethnicity, and religion, by country, all of those things, but each family has its own culture. So to think that, we're all going to do this the same way or come about this the same way is a disservice. We are all going to grieve incredibly differently, and think through these things very differently and come about this very differently, and all of that is okay. So just giving each other the permission to come about this very differently. Nisha was saying earlier that being incredibly gentle with your family when they're like, oh, why don't you come over for Thanksgiving? And you might be like, oh my God, I can't believe they're inviting me over. Or your family might be like, so are we still coming over for Thanksgiving? And you might be like, have you seen? Do you know we're in the play? So being like kind and gentle around those incredibly difficult conversations around some of these things. You might think you're part of the same family, and you are the same family. I'm not saying you're not the same family, but even in the same family, culture can be perceived very differently. So just a word on culture. So I don't have very much time here, but I love the picture that Nisha put up at the very beginning of her presentation, where the gentleman had paper cutouts of his family members because he was not having them over for Thanksgiving. But that's how he modified his family tradition of Thanksgiving. So just for a few moments, there's a few people here, and I just wondered if we could perhaps open up the chat, and if people would be willing to maybe put into the chat what traditions are important to your family around the holidays. And if you've already thought about how you might modify these traditions, so that while they are modified, they might still hold their meaning and still continue to bring joy to your family. Because I know it's still so hard again, the quarantine and the pandemic has been so very long, and I know we're still looking at a few more months of it, even with the vaccine. But I'm just curious if people have given this piece any thought. And perhaps you haven't, and maybe you will afterwards, after this presentation. I'm looking at the chat. Okay, someone said that they appreciate the affirmation about how challenging it is. Yeah. Someone said their friends are having a Zoomsgiving. I love that. More power to you. I've tried a few Zoom things, and the cacophony of voices, and we have some young children involved. So, but more power to you. I hope it goes really well, and you can have your finger on the mute button should you need it. Mute is a beautiful thing. We do a gingerbread house building contest. Oh, I love that. That will be broadcast via Zoom this year. Oh, that's brilliant. I want to bake and deliver desserts to coworkers. Oh, that's such a lovely thought. I miss celebrating with my office. Yeah. Or you will continue. I bet you are one of their favorite coworkers and you will continue to be their favorite coworker. That is fabulous. Cannot go wrong with baking desserts for the office. Any other thoughts or questions around this, or even struggles with not being able to sort of traditionally or celebrate traditionally as you would holidays with the family or loved ones? We're doing a drive-by, pick up your food, mini pies, small containers decorated. I love it. Lisa Kaufman. I love the drive-by stuff. It's, you know, you get to see each other, you do a little wave, you still get the food. I also think it helps if you think of the silver linings of things that perhaps were not your favorite, but I'm joking, but like still maybe, you know, there were parts of the holidays that were not your favorite that you're maybe not having to worry about. I miss my tradition from the winter holidays that involve going to New York City for activities with friends. Yeah. Not having to clean your house prior to the gathering. That is huge. There you go, silver lining. I love that. That is a big one. If there was ever a reason to not have to gather. Well, I thank you so much. And, you know, from a friend, outdoor Thanksgiving, making individual pot pies so everyone gets the whole meal in one dish. I love that. And cleanup is easy, right? I hope these have like jogged ideas for other people too, if you're sort of like struggling with Thanksgiving dinner in your pajamas. That I think has been one of the greatest things about this whole quarantine is how much we have been able to stay in our pajamas. But someone else, I think I read somewhere that people were sharing their entire menu, and everyone was cooking the same meal in their own homes, and then having the first person who said, I'm sorry, I did not read all of your names. I apologize. I should have done that. Over Zoom. And then, so having the same exact meal and then eating it over Zoom, which is a lovely, lovely thought too. So I think that is my time. I thank you so much for sharing all of your ideas. And I hope that this jogged a little bit of ideas if you were struggling to come up with modifying some holiday traditions. So thank you so much. I'll stop here.
Thank you, Wahida. And thank you everyone for typing in your responses into the chat. So now we'll turn it over to Robert Macy, who's going to be speaking about meaning making. And he is the founder and president of the International Trauma Center in Boston.
Good evening, folks. Thank you for your time. I know time is precious. We all really appreciate you spending part of this evening with us. My respect and deep admiration to my two colleagues who I'm following. It's going to be a tough act to follow. They've both done, I think, a fabulous job setting up what we hope could be a type of a summary for all of you to consider in terms of Nisha's overall ability to let us know, although we've heard it many times, very clearly that the thing we want to do the most is probably the most risky thing we can do, which is to travel and be with those that we love. And Wahida, as always, is such a fabulous, humane and deeply felt presenter. And I love the way she was able to lay out some of the specifics around grieving And then also, how do we adapt to the holidays with this grief literally in our bodies? One of the sayings that folks use when we talk about trauma and grief and exposure, for instance, to quarantine and the sadness and isolation that comes with it, is that the issue is in the tissue. Literally, the body holds a lot of the memory and a lot of our reactions. So what I'd like to focus on is thinking about survival, thinking about what resilience is, how to access it, and talking a little bit about adaptation. Nick, next slide, please. Oh, there we go, okay. So to our title, how do we survive the 2020 holidays? Can we find our way? So these are, again, suggestions and ideas for us to play with, and we have about a half an hour before we'll say goodnight to each other to talk about all of the different aspects that we've discussed, including these fabulous contributions to the chat room. Perhaps we can start with, what is it that we need to survive from or survive about? And really importantly, who do we want to survive with? Who do we want to be in this, if you will, this boat in the storm, surviving, and what is it we're trying to survive from? Does finding our way mean we have to figure out how to get around this COVID-19 mess during the holidays? And Wahida did a fabulous job talking about grief is here. It's part of our experience, and you really can't get around it. And if we can't get around it, what could we do? You could say about it, or I'm going to hopefully lay out what are some things you could do with it. And Nisha similarly, spoke about the impact of the disease and the impact of how it basically has us pinned down. And human beings do not do well when they are forcefully immobilized, as you can see, and it's played out across the national stage. So I think it was Thoreau that said the only way out is through. And I don't mean to be glib here, and certainly I don't mean to be pedantic, but I just ask us to consider that if we have to go through this, what are some ways to do it, and who do we want to do it with? So for at least 100 years, you could argue 500 to 1,000 years. I'm saying for the last 100 years because as I think Nisha and Wahida both referenced, in 1918, we had a global pandemic, was the last time. Folks have celebrated ancient rituals that go back across many, many millennia that we now call holidays. Many of them congregated near the end of the year because of lunar cycles and sun cycles and just the way people were doing harvesting, and the way humans decided to congregate and to give thanks to those things that they held sacred. So as both of the other speakers pointed out, it's a very big deal that we're not able to do this the way we normally have been able to do it. So this year, just to name it, not to rub it in, because I think this is part of how we all can shape our grief into moving ourselves into this holiday and into our future. This year, we cannot celebrate as we normally do. We cannot join our community to congregate, to commune, to conspire, which really literally means breathe together. We can't engage in long established rituals. And those are many. Wahida did a great job again, getting that cup of coffee at that shop at the right time of day. That's not just a little thing. That's part of your physiological rhythm of how you're going to accommodate both stressors and rewards in your life. So belonging turns out to be a very, very large deal. It's a big deal for humans. And we need and want to belong to certain groups, to certain people, to certain sunsets, to certain animals, to certain places. You could even say, and many people have been studying and writing about this for decades, the concept of belongingness really drives much of how we shape ourselves and what we do. So simply put, who do I belong to? Who belongs to me? How do I know I belong? What if I want to belong, but I'm not belonging? What if I belong and me and my people get lost? Is someone going to help us? And I would submit that certainly is one of the driving series of questions that children have as they develop, and that parents try to do parenting children is shaping belongingness. And I would also submit as well that this is probably something we are all dealing with even before COVID hit, or challenged by, or excited by, is how is our belonging going? And the COVID comes, the pandemic comes, which is a type of annihilation event where you can't get away from that which could hurt you. You don't know when it's coming or how it's coming or who it's going to hit next. So who do I belong to? Who am I safe with? Who do I want to belong with, but they're no longer there, either physically or because they were lost to the pandemic? So somehow we need to survive from or with this enormous change. It's a huge change. So if you just could hold for a second the concept of this, and if you could think about something lovely or silly, we've all had this in our lives, but all change equals loss. And Wahida hit that very clearly. And human beings, again, they know they have to go through it, but it's not our favorite thing. Change is not our favorite thing because it almost always involves loss, whether it's the first car you bought that finally broke down, or one of your first loves, or one of your first jobs, whatever it is. Change equals loss. Enormous change can equal enormous loss. And we have the numbers. We don't need to review them again. Nisha did a fabulous job, and I think it's important that we look at the numbers for both our state, our counties, our families, our communities, and certainly for the nation. The loss is tremendous. So we're faced with surviving loss, back to my first original comments, as one of the things. And I use that term carefully because loss certainly involves grief, which we'll talk about in a moment, and which Wahida laid out. But I'm going to ask us to think about this concept of loss, because of course it's powerful, and change equals loss. And as you accommodate loss, change continues to happen. So we're really surviving loss, which means we're really faced with surviving, moving through, accommodating, grieving. And I'm not pushing a silver lining, but perhaps discovering new rituals. And some of the comments in the chat were wonderful. I think creativity is one of the expressions of resiliency, and I think we're hearing it from our audience. We're not going to let this thing put us in the darkness. The darkness shall not overcome the light. So we reinvent ourselves and reinvent our rituals. So grief is a normal and natural reaction to loss of any kind. I'm going to ask you to consider recognizing and constructively engaging in your losses from this pandemic and other events. Wahida named them, Nisha named them. I'm going to add a few things. Certainly physical separation from family and friends is a big loss scenario. Loss of daily routines, especially social routines and rituals that calm down and keep your body in a rhythm that makes you feel safe, calm, and comfortable. Loss of personal freedom, having to stay indoors, especially now with the winter coming. Loss of basic assumptions, as Wahida pointed out, about security and control. Control is a big issue, which we're going to talk about before we come back together as a group and see what you all think about all this. The idea of control and who's in control. And control plays a central role in how we can reinvent our rituals and reinvent ourselves, even in the giant challenge of this pandemic. Various loss of others. We feel the loss as our friends and families suffer their losses. And then, of course, the death, the annihilation of people that went too soon, people that didn't get a funeral, people that weren't able to have visitation. So I love this piece. And this really comes from female researchers from the 80s who've continued to research creativity, resilience, and now grieving and resilience. And it's not something you're supposed to recover from. That doesn't mean you're going to stay in deep grief for the rest of your life. But I think it can help us, give us a hint that it's not about going away. Grief doesn't go away. Grief shapes you and you shape grief. So it's not a recovery paradigm. It's really an experiential, embracing engagement in what grief offers you. Grief is normal and at times perhaps overwhelming, for sure, certainly now. Process that can allow you to design and control how you shape yourself and your loved ones and your children as you move into your future. And admittedly, and I thought Wahida did a great job with that fabulous laugh and sincerity, like, this is kind of a hard thing to hear, right? We're going to shape ourselves into the future, but the future is more COVID. At least till when? What are we going to say? March, April, May, June? We don't know. And there's lots of talk about the vaccines. Future orientation turns out to be a critical piece for us, moving into the holidays and the end of the year and waiting for the vaccine. Being able to protect and find meaning in a future orientation. So I'm going to ask you to trust your body, trust your brain. It's a very old system. It knows how to survive. And with some of these suggestions that we're making, your body and your brain congregate with those, even if it's through Zoom, and allows you to come up with a future orientation so you can take the grief from the loss and begin to shape yourself, shape who you want to become, even for the day of Thanksgiving. And we started tonight. So we're actually preparing for the ritual that doesn't happen until next Thursday, which is a very, very human and really ancient thing to do, is you prepare now for something that's a sacred ritual a week away. Acknowledge your grief, which doesn't necessarily mean accept it, but acknowledge that it's there. I think Wahida touched on that. And acknowledge the overwhelming nature of it, which is going to create some of the things she's talked about. Exhaustion turns out to be a huge expression of loss and grief. Pandemic grief, grief from isolation, quarantining, disconnection, has some of the deepest sense of physical exhaustion. This has been studied for a long time. Obviously, the overwhelming nature of the loss and the grief includes loneliness, sadness, anger, fear, isolation, and even emotional pain. Honor your grief. And this turns into celebration. And I think we've already been discussing this with Wahida's intersection at the end of her talk and asking the audiences, so what are you doing? What are you doing out there for Thanksgiving? You can shape your grief and have your grief shape you. And obviously it's very personal and it has to do with who you are and how you express yourself. Understanding expression is a key to moving through grief and allowing grief and loss and joy to shape you. Expression comes from the Latin expressare, to press out, to bring from the inside to the outside. So you can write about this, you can dance about this, you can sing about this, you can pray about this, you can meditate about this, talk about it, draw about it. Always knowing that when what you are experiencing is normal, it's important, it's valid, even when it's sometimes overwhelming. In other words, your losses and how you accommodate grief can be transformative. They almost insist on it. And by the way, this wonderful laundry list, write about it, dance about it, sing about it, pray about it, meditate about it. You can do this solo, or gloriously, you can do this with others, both in your own pod, survival pod at home, but also on Zoom or on FaceTime, or even just with the voice to the ear. So I'm going to play with this as I begin to close. Think about making specific plans, which I'm guessing most of you have started, to be in touch with others, to reach out when you need help, to reach out to others who need help and support. It turns out giving has a very large, healthy boost to the immune system. When you're giving and there's no payment in return, you're giving because you want to help, you want to support, you want to help congregation and community survive. Grief can allow you to access your resilience, which can be a natural positive capacity. We're not born void of the process of resiliency. It's not a product, it's a process. It's transmuted in our DNA. We are wired for it. The natural positive capacity people have to adapt to multiple survival stressors. We can certainly list, for all of us, we could list 2 to 3 major challenging stressors that 2 or 3 of which we haven't had to face before, all coming at once, right? It's a large number of, if you will, bricks on your shoulders. It's a dynamic process where people exhibit positive behavioral adaptation when they encounter significant adversity, toxic stressors, and trauma. I think we all qualify and the environment qualifies. So let's look at survival for a second. And I think, again, you know, I keep invoking Wahida, but when she got into the cultural piece, she talked about kindness and gentleness. And this is exactly where this is going. Does survival of the fittest really mean those humans that most often relate from a state of fear, of dominance, of strength, who has the largest jaw, the biggest teeth, the biggest muscles, the biggest bank account? Does survival of the fittest mean the people that are the most aggressive in the service of their own preservation? Does that what fittest really mean? It's a trick question. Or what if survival of the fittest actually means those humans that are the most gentle, the most cooperative, the most collaborative? Because survival often requires, in fact, even demands mutual help and cooperation. To survive, you have to adapt. To adapt, you have to cooperate. To cooperate, you have to co-regulate with one another. Now, that may be a new term for some, but you all know it and feel it all the time. When you get the vibe, when you're in a rhythm with someone, when you kind of have that bonding, sometimes it's not even forced, it's just there. It's sometimes called attunement, right? Where you can kind of be next to each other, but not even talking. So it's called co-regulation. And it's something we do very well if we make ourselves the space and place to do it. So COVID holiday survival. So just bear with me here and see what you think. This is from Viktor Frankl with a little help from his editor, and I threw in a teeny bit of my stuff. This is mainly Viktor Frankl. Forces beyond your control can take away everything you possess, except one thing: your freedom to choose how you will respond to the situation. You cannot always control what happens to you in life, but you can almost always control how to acknowledge your feelings, how to react to this event, how to do about it what happens to you. You have control over that reaction. Sometimes you don't feel like it. Sometimes you're too exhausted to even try and exercise control. So again, this is a practice, and I would ask you to start by being kind to yourself and gentle with yourself. There are going to be days and weeks when the practice of this is going to be more difficult than other times. We are hoping, and knowledge from prior situations, pandemic situations and quarantine situations, certainly have helped us learn that congregating with special people, following safety guidelines, so no one's worried about, am I doing something wrong? Am I infecting somebody else? Am I going to get infected? Which reduces your calming, your safety, and your comfort. So we're not just trying to follow the rules to protect everyone per se, we're following the rules to get the most out of our ritual. So you're not worried, you're not nervous, you're not anxious. So congregating and exercising some control as a community over your reaction to the fact that this Thanksgiving got taken away. So we're doing a new one, we're doing a different one. By the way, if I might have missed a punchline on survival of the fittest, but any of you that have studied history and studied anthropology know that at one point there were 12 Homo sapien tribes running around on the globe. 11 perished. We are the last, as one author says, we are the last ape standing. And it's because we were in collaboration, in cooperation. We were able to adapt to circumstances. We were able to co-regulate. And we win, so to speak. So admittedly, this takes practice, knowing what you can't control and knowing that you still have the freedom to choose how to react to what you can't control. And we can build the practice, especially if we can kindly and gently ask ourselves the question, am I worthy of survival? Am I worthy of having joy and gratitude and gratefulness this Thanksgiving? And who do I want to survive with? Who else is worthy? Who else do I want to protect and love and collaborate and co-regulate with so we both feel worthy of surviving? This helps us answer the question about making meaning, even out of the most ridiculous and hard challenges like COVID. You're going to get this handout in the emails. This is just, it's a lovely piece of work that's about 50 years old that's been contributed to by many, many different researchers and philosophers and teachers from all domains of investigation. that one of the things we count on for rituals to give us is safety, calming, connectedness, efficacy, like feeling worthy in the eyes of our peers, and ultimately hope. All right. So in line with what Wahida and Nisha were expressing and suggesting, again, we're not prescriptive here, we're just making some suggestions. This works well. I've done it a lot. I'm certainly doing it with my family and my friends. And obviously I want you to customize it and make it exactly your own. But it's the idea of a family attachment map. Draw your own family connections map, which creates support for your future orientation, not only for Thanksgiving, but between Thanksgiving and whatever the next holidays are and the New Year's. So we've got a succession of these rituals that we're going to have to adapt and accommodate. So this is one suggestion of a family connections map. So what you can do is take a blank piece of paper. You can do it alone. You can do it with family, which is a hoot. You can each do it alone and bring it together. You can do it more than once. The idea is that you want to put on here everybody that you really feel like you'd like to connect with, no matter how far away they are. So for instance, this is an example. This isn't personal to me, but, and you know, this is a small graph, but you can see the longer lines are people that are farther out, just because I'm not going to be able to sit with them for the meal or for the congregation, right? You're in the center, you're not being egotistical, you're just exercising some control over what you can control. And this is the lovely part, I think, about what all three of us have been saying is we can control who we connect with. And that's going to make COVID very angry, because COVID obviously is random virus, which is not even alive, but the pandemic has created mayhem of disconnection, and we're not going to let it happen. Now, how do we do that and still stay safe from the virus? So I think we've started to outline that this evening. So I'm just asking you to play with this idea. Create a map, a family map, and I use the word family specifically. It could be all your social connections, but you know, you've got a day, and you've got about 6 days to plan for this now. Who do you want to Zoom? Who do you want to get on the phone? Who do you want to FaceTime? Who do you want to text? You don't have to be overly structured about it, but just getting a hopeful idea together of the map of people you want to connect with, even if it's a 3-minute hello, allows you to do something you might not normally do with your regular Thanksgivings, where you congregate there and you're all in the house and you just pay attention to each other, which you're still going to do, but people are going to be missing, which means co-regulation. Connectors are going to be missing, and you certainly can control reaching out to them. Thank you very much.
Thank you so much, Robert. And before we move to Q&A, which my colleague Anastina Wardlaw is going to be joining us for in just a minute here, I wanted to share a few ideas that I collected from some friends along the lines of what are they doing this year. And so one family told me that they use Thanksgiving as a kickoff day to 30 days of kindness. And then in that time period, they go around and do sweet things for their friends and their neighbors, like dropping off cards, handwritten cards and letters or snacks. And they shovel someone's driveway or rake their leaves. And it's a way that they teach their kids to be giving in these ways. Another family told me that they plan to do a large puzzle together and that they're going to spend a few days working on it. Another family said that they are going to be sending out gratitude cards to all the people that they would normally see during the holidays that they won't be seeing in person this year. And just one more here is a family said that every year they record a video of each person saying what they're grateful for. And then they put it all together as a montage, so you get to see how that person changes over the years. And I thought that was kind of a nice tradition. So I'm gonna have Anastina now come on. And Anastina, did you have something that you wanted to share as an idea?
I do. I shared this story with Jen earlier, and she asked that I sort of pass it on to you. I have been thinking, I have 3 children, 2 of whom live in California and won't be able to be with us this year. And I certainly, like many of you, have been thinking about the loss around traditions, And there's a specific tradition in our house that has been going on for years and years since our son was very, very small, which is he and my husband make the latkes every year, and they play the Who Quadrophenia from beginning to end. Without fail, every single year, they make the latkes together. And this is the first year, my son is 25, that they won't be able to do it. And it's a huge loss. It's like making me a little teary thinking about it. So one of the ways I was thinking about, Robert said, all change is loss. And I've been working around a quote that is, where there is change, there is opportunity. So I've been working with that because I've been just striving to find meaning with my children that are so far away. So with this tradition with the latkes, our son in LA received a special pan to fry his latkes in. He is getting the family recipe that has been passed on for generations. And my son and my husband and my son will be making the latkes virtually through Zoom at the exact same time, listening to Quadrophenia. So there'll be a greasy smell and the Who in my house, which is like so important for me in the holidays. So I thought I would just share that. But I allowed myself to really feel the loss and then sort of shifted around a little bit and tried to make meaning of it. And I'm hoping that, he's 25, that when he has a family of his own, he can make his latkes with his kids and play the Who. So I think I'm going to move on to Q&A now. You want me to go first, Jen, for the first question?
Sure.
Okay. So I'm going to ask this for Nisha. We know, having COVID, that the individual is immune for 3 months. However, we haven't heard that after the vaccine is administered, how long will it protect people? Will an individual need more than 1 dose in a calendar year?
So the answer to that is yes, they will need more than 1 dose in a calendar year. I'm not sure if I can share this, but so right now there are 2 vaccines that are being in development that are in their phase 3 clinical trial, actually. So one is from Pfizer and the other is from Moderna, I'm sure, as a lot of us know. But the COVID Corps has condensed all the information that's out there about the vaccines that include what type they are, which also brings information to how it works, the delivery method, the storage, the dose. So both of them will be 2 doses. And then also where they stand right now in development. I'm not sure if I can share the figures. Am I allowed to? Do I have screen share? Oh no, I don't think so, but I can drop the information here in the chat for anybody who wants to. Oh, okay. So it says that host has disabled attendee screen sharing. I'm just kidding. So let me get this going. So here's the graphic for the Pfizer vaccine. And as we can see that there are 2 doses. So the first dose will be injected, since it's a hypodermic needle, and then patients after they receive the first dose will have the second dose 3 weeks apart. As far as how long that immunity lasts, there's not enough information out there right now for me to be able to answer that question, but I can say that you will need 2 doses for the Pfizer vaccine. Switching gears to the Moderna vaccine, again, it's a hypodermic needle, so you'll get the first dose injected, and then 4 weeks after, you'll get the second dose. Again, there's not much information as far as how long immunity lasts from that perspective or from that vaccine, but you will need 2 doses for either vaccine. It's just a matter of being 3 or 4 weeks apart. And you all have the link, so the COVID course created this graphic, and that's available out on Twitter, as well as through email if necessary later on to reference.
Great, thank you, Nisha. And we got a question. I was thinking maybe Robert would take this one. The person asks, where do we find hope with the possibility of lockdown on the horizon, especially if you're already struggling and you're getting help and still struggling? I'm happy to repeat it if that's helpful.
I did hear it. and maybe Wahida can tag team with me on this one. It's a really important question, and I think it goes to the heart of the matter, which is each month we hoped it would get better. Each month we're waiting for the vaccine. Schools closed. Then schools were supposed to reopen, then they didn't. So it's a successive series of challenges or really bad news over and over again. And you're trying to get help and you're struggling. And I think that's really important, although it may sound self-evident, that we start with acknowledging, wow, this is not getting better. I think it also goes without saying, but sometimes we forget this. If you have someone to share this with, you're going to end up being in better shape about how to adapt to the fact that we still have more incoming challenges before we can get some relief. I want to share a story that has been studied a lot and was actually then been researched recently, and I'm happy, although it's a bit of a geeky article, but there's a couple of good articles on quarantine stress and quarantine exhaustion that address this specifically, where you can't get away from that which is hurting you. And as I said earlier, human beings don't do well with that, but we are wired to handle it. And everyone's going to do it a little bit differently. And some of you may know about this, but in World War II, prisoners of war that were taken prisoner and were held sometimes for years, maximum was 4 years, 4 or 5 years. Many of them perished. The ones that survived due primarily to one of the oddest things you could ever think about. You can say it was positive attitude, deep inner strength, all of that helps, but that wasn't the deciding factor. It was those folks who woke up in the morning and said, I'm going to do my best today. I'm going to shave, I'm going to shower, I'm going to keep my daily routine up. They didn't say and hope and think, by Christmas, I'm going to be rescued. By Easter, I'm going to be rescued. By whatever, I'm going to be rescued. Now, I know we're not in combat, but this is a type of combat, if you will. We're certainly at war with this virus. And so I'm not just saying keep your chin up. I'm saying specifically 2 things that hopefully could be helpful for anyone that feels this intensity of, my God, we got to go through more of this. 1, your activities of daily living, whatever they are, especially the ones that bring you some joy, really important to engage in. When I worked with Katrina hurricane survivors that were flown at gunpoint from New Orleans up to the Cape Cod Air Force Base, and they'd all been standing in water for almost 7 days, some of them starving. One of the things that brought all of them a lot of joy and comfort, and they didn't know what was going to happen to them, was because I knew about this research, was we went around and asked everybody what kind of toothpaste and toothbrush they liked. We went out and we got their favorite toothpaste and toothbrush because it reminded them of a part of home, a part of their activities of daily living. So to the extent possible, whatever you were doing pre-COVID that you enjoyed, that you can do today, don't give those things up. That's really a practice that I'm going to ask you to continue doing, or invent some new stuff as well, some new routines that you like. Secondly, we can't stress this enough. You have to figure out how to stay connected. And one of the people that many of us forget to stay connected to is ourself, your relationship with self. And that can really be engaged in by doing prayer, dance, writing, listening to music, spending some time in solitude, even if you feel a little bit miserable. As long as you're choosing to be in solitude. If you feel you're forced, then that's isolation. But having some stillness practice is really, really going to be important for you. And as I said, I'm going to stop here and see if Wahida wants to weigh in. Thinking about how you want to view your future and allowing the future that you see to be partly dark and gloomy, like this is going to take a long time. That doesn't mean you don't have space for another future that is going to come. And we do have a little bit of evidence. There was a downturn in the numbers throughout the country as we moved into the late spring, early summer. There was also prediction that it was going to come back. So we know that there's cycling. Cycling is going to go down. and things will improve. And so allow yourself mind and heart, space and place to say, you know what, there's a gloomy piece out there, but that's not the only thing I have to contemplate. Wahida?
So I just want to echo a couple of things, and you know, be a little bit of and I'm hesitating to say this, but it was a little bit of a wake-up call when I heard this, and I can't remember exactly where I heard this, but I do think it's true that we are probably, vaccines notwithstanding, and with the vaccines, about probably midpoint through this, and that's harsh of a reality, but because even with the vaccines, there will be continued mask wearing, and and Anisha is probably more the person who should chime in with that. But I think managing expectations of where we will be as a country. And so people are like, we'll get the vaccine and be on our way. But what Robert said about like the woe pony sort of like, all right, like, probably won't be there. But I think that sort of like, it's important to look to the future, and it's important to be like, and today, right? And I like, if the future is too long, you can be like, and I can just get through today. Like, what is my today going to look like? That can be a really important milestone for you to set, and a goal for you to set. Remembering, the grief circle that I was talking about, that cyclical nature, that's, remembering that it's okay to feel really, really not okay, and knowing that you might get to that okay place, and that good place maybe even. And as overwhelmed as we feel, the routine piece, the structure piece, I want to emphasize that. But the thing I want to emphasize the most is the connection piece. I don't think we can underline that, highlight that enough. And that piece sometimes is the first thing we chuck because we feel overwhelmed, and there's work, and there's life, and there's this and that. And I'll just text that person later, or send that, but I think back to the earlier days and weeks and months of the lockdown, and we as a community, and as a, we were, I think, making a lot more effort for connection. And then I think we just got tired, or life got in the way, and we got back to routine. And, think about it, the musicians were doing more concerts, and artists were doing more doodle zooms, and there was just a lot more engagement and, connection trying to happen, and, a lot more things happening. And I do think there was just a sense of fatigue, and it just wore off, which is fine and fair. But if you can put that task on the top of your list, and be like, I'm just going to send that text to my friend before I send that work email, because it's even more important. I promise you, it's more important. Those work emails, I'm still sending them, and it's almost 9 o'clock. Those will not end. They will still be there tomorrow. But that text to that friend, or that connection that you have been meaning to make, would be so much more important. So make those connections, even if it's via text, get on the phone, FaceTime, whatever, and try to reconnect in those ways. And, so just want to highlight that again. Now you've had two people say it.
And I just want to echo what Wahida was saying, and also what Dr. Macy was saying, as far as how long we might have to, have that mindset of like going through and having that grief process. Because even if the vaccine, so right now there are talks with Operation Warp Speed, which is a government program that is working to fast track the vaccine to the market and make it possible for the general public to receive it. Even with Operation Warp Speed releasing the vaccine as soon as December, as some people are claiming, or as soon as January, as other officials are claiming, it does take about 75% immunity for the population to be immune in order to achieve herd immunity. So before we can really start easing up on those mitigation strategies, 75% of our population needs to be immune, whether that's from the vaccine or whether that's from infection itself. And there's a lot of vaccine hesitancy, and there's, preferably we would get that through passive immunity with the vaccine rather than cases, because again, there's so little data out there as far as who's really at risk, because sometimes it's our elderlies, but there's also evidence showing that there are people that are in the 20 to 40 that are dying of COVID, and also COVID-related complications. So just to echo what Wahida and Dr. Mesa was saying, is that it could be a lot longer than we realize, even with the vaccine, because again, one intervention is not an end-all be-all.
Thank you, Nisha. Our next question is about grief and loss and death. Specifically, how or what is the best way to support someone who has experienced a recent death through COVID, especially during these times when we are supposed to be socially distant? So that could be for Wahida or Dr. Macy.
I can chime in. I think, remembering, all of the same rules still apply. Continuing to reach out to the people, the person who's had this loss, as you would. You might not be able to be physically close to them and offer them that hug and that you might have, but calling them, perhaps, a socially distant visit, if that's appropriate. If you're in the same, I'm assuming you're in the same geographic location. But if that's not possible, showing up, I would, caution against saying things that sometimes people really well-meaningly say, but often don't quite land the way you intended them to land. So just be careful and cautious with your words. It was, and I'm just going to use some examples. I'm not saying this is what you would say, but this is just what I've heard. People sometimes be like, "Can you believe they said?" Things like it was their time. They're in a better place. At least they didn't suffer too long. Again, these are really common things that we say. And again, they're said so well-meaning, with a lot of good intentions and well-meaning. And often they're said to fill empty space and quietness, and people feel uncomfortable with quietness and or quiet and say these things. And other people are like, no, their place was with me, or there was no good time for them to go, or they did suffer, or whatever it is. So just, saying the usual, I am so sorry for your loss. And usually just being quiet is the best thing to do with that. The other thing I would recommend is it is not uncommon for people, who've had a loss to get a lot of activity or a lot of support early on, and that for it to then taper off. So, check in with them, once a week for several months, because by then usually people had tapered off. If it's I don't know who it is that they lost, but use the name of the person who it is. If it was a child, especially say the name of the child, because people get really uncomfortable if it was a child, and don't say the name. So just little things like that. If you have more specific questions, please put that in. But a lot of those things still apply. You can, again, culture comes into this. Some cultures don't like flowers sent after a death, but if it's sort of traditional American culture, you can always do that. I don't know any culture that doesn't appreciate food being sent over. I could be wrong. I'm sure I don't know every culture. That I should take that back. But usually food is a good thing. I don't know. But be, in culturally sensitive ways, you can show some love and concern and care. Go ahead, Robert.
Thank you, Wahida. Actually, you reminded me, and the question reminded me, for those in the audience who have lost someone, when I was speaking earlier about grief is not something you recover from, I didn't go into that further, but I thought I could offer to you all a piece now it's really hugely important. And I'm a practitioner, and I work primarily with group and individuals after trauma, but I'm also a researcher. So this is beautiful longitudinal research on grieving and grief, and especially around sudden loss or loss of loved ones. In the old days, they would say, you really want to try to get over this as quickly as possible. You don't want to keep the pictures around. You have to be healthy about your grieving, and you have to move on. The new research is really almost the opposite. The new research says, and of course, there's a huge cultural interdependence around this, because there's cultural norms and cultural ritual around how you move between the two worlds, your current world here and the person that's passed on. So there's all of those you have to obviously honor with your own traditions. But generally, the new research is saying, allow yourself to feel the loss. Don't rush it. If you want to have pictures of them, if you want to write letters to them, if you want to sing to them, allow yourself to be steeped in their presence. That way you actually don't get stuck in what's called complicated grief. You take your time to slowly allow them to move out of you, and you can still stay attached to them. So that's very important. And if you're struggling with that and you're not sure about that, reach out to your primary care physician. And most of them are pretty versed these days in Massachusetts in terms of referrals to behavioral health specialists who could help you with some of these ideas of how to really stay joined to the decedent and take your time in allowing your body to not even let them go, but to allow them to change into where they're going, so to speak, and allow you to be able to accommodate and adapt to that loss.
Thank you, Robert. So now, in the interest of time, thank you so much for taking those questions. I think we'll move on now to my colleague, Neil Boyd, who is an outreach counselor with MassSupport, and he's going to be presenting a little bit on self-care and then also closing out the night for us.
Hello, everyone. We want to talk a little bit about self-care after all these great speakers tonight. Starting off with reflection. Google said reflection is the drawing back of a body or surface of light, heat or sound, without absorbing. So I'm asking you today, let's look at the opposite side of this and absorb the light that's shining on you as far as your best you. Talking about the best person you are. Take a little reflection of that person. Think of your good times or the vision that you want one day of yourself in the future. Can you feel the warmth and the heat and the sounding joy that comes from that? I think about a verse that says, so think of the man, so is that person. You are what you think. If you think you're a great person, a wonderful person, you are a wonderful person. If you think you're not a wonderful person, you're not a wonderful person. It's according to how you think and feel about yourself. You got to take time for yourself to think in a more positive or meditation on how great it is going to be for your future. Your future. The positive thinker sees the invisible, feels the intangible, and achieves the impossible. That was by Winston Churchill. talking about the positive thinker. Real self-care. This is what real self-care is. It means giving yourself permission to pause, giving yourself permission to take a break that you can kind of recoup. And because sometimes, even especially from the pandemic, we see we still got to take breaks ourselves from everything going on. I always said that if you don't come aside, you'll come apart. We all have to come aside and really take care of ourselves with joy and do things that's peaceable, whether it's listen to music, read a book. These things help us that we can go on to the next day. You got to train your mind to see the good in everything. Positivity, believe it or not, is a choice. The happiness of your life depends totally, really, on the quality of your thoughts. Ain't that something? Your thinking will decide if you're going to be positive or have a great quality of life, or how you think. I was telling a friend the other day, if you find a place inside you where there's joy, the joy can burn out the pain that you have inside. But you know, most of the time in life, we deal with the outside man, but we don't really deal a lot with the man on the inside, the person that's inside of us. That's the true person. Because if you work on the inside, then the outside will clean itself. It will act accordingly. It'll be trained. But it's really, in COVID, it's really making us to be more inside people. But this is also goes to maintaining connections, because it's important that we do maintain connections during this time. Most say maintaining connections with others is very key to maintaining ultimate physical and mental health. Some of us have lost some loved ones who have left this world because of COVID-19 and other things, which can make the holidays a real drag, you know? And that's what most people feel like, man, this is gonna be a drag. The holidays ain't nothing because of people we lost and we're hurting. But I tell you one thing, this causes sometimes us to withdraw from others, feeling alone and lonely. But one thing I've learned as a human being in the lonely times, that I'm part of the whole called by many the universe. Now, many people are spiritual and religious and they go on to spiritual things, but I'm talking about the universe. What is the universe? It's something that connects us all, that we're all connected to. And there are other deeper connections. Like, for instance, if I can use my brother who passed away years ago, at different times in my life, I have a connection with him and he's passed on. And I can actually feel him talking to me. Somebody said, oh, I don't understand that. You yourself will have to get in meditation and just sit still in silence sometimes. You know, a loving silence often has far more power to heal and to connect us. Just by being silent, you can get a connection. Not because you're not rushing anything no more. You're patient and you're just sitting down, eyes closed, just thinking. What that helps you to do, what it really is, it's a spiritual path, which is not a lonely one. You're not going to be alone. It's not solo once you go on a spiritual path. Even when it comes to meditation, you know, meditating by yourself, you're going to find yourself with a greater connection that can bring peace to you and really care for you and bring a peace of mind and a peace of heart. And also, believe it or not, this helps brings meaning to your life. See, life itself has no meaning, but each of us has meaning that we bring to life. So your meaning will bring life, because life itself has nothing without your meaning. That's just how important you are. You're very important. Your life, learning, and the many questions you've had in your life, the many mistakes you've made, and you might say, well, I'm not really having achieved anything. I'm not really anywhere in life so far. It has not been a waste of time. The things you go through have not been a waste of time. My dad used to always say, son, you live and you learn. That's how life is. You live and you learn from your mistakes. And I know a lot of times we afraid to make mistakes, but I always say this, show me somebody who never made a mistake, I'll show you somebody who's never done anything. Because success comes from people who make mistakes, who are not afraid to venture into the unknown. That shows the courage that you have, and it's there, believe me. But you got to look within. That courage is deeper in there. It's in there. If you feel for it, it's not far from you. We live and we learn. So whatever we are, whatever we make of ourselves, it is all we live, we will ever have. And that in its profound simplicity is the meaning of life. It's real simple. It's not complicated. Your life is going to be a powerful story one day because you learn how to take care of yourself during these hard times. But that first starts with one thing, learning how to love yourself. Whitney Houston, the late Whitney Houston, she sang a song, says, the greatest love I found is inside of me. Wow. She realized the true love, because a lot of times we look for it in a lot of places, you know, and I know we lose some loved ones and we really hurt, you know, and we feel like we can't love anymore. But that real true love is the love that's inside of you. See, when you love yourself, you glow from inside. You attract people who love, respect, and appreciate your energy because they can feel the vibes of their love. You ever been around somebody that had a lot of love and had a joy, and you maybe was a little down, and you got around them, and it just, you felt the vibes. The vibes just lit you up. And you feel like, well, I don't know what I'm sad for. Oh, I feel good. Everything starts with how you feel about yourself. Start feeling worthy. Start feeling valuable and deserving of receiving the best life, the best that life has to offer. You deserve it. To fall in love with yourself is the first secret of happiness. If you want to be happy, that's the first secret of happiness, is falling in love with yourself. That was by Robert Morley. That's what he said. But I remember Maya Angelou said this, you alone are enough. Somebody said, I'm alone. You alone are enough. You got what it takes, and it starts with you, that love. You don't have nothing to prove to anybody. You alone is enough, but you got to keep those connections. Bottom line is this. Love yourself enough to take actions required for your happiness. Love yourself enough to cut yourself loose from the drama-filled past. Love yourself enough to set high standards for relationships. Love yourself enough to feed your mind and body in a healthy manner. And last of all, love yourself enough to forgive yourself enough to move on with your life. Next slide, please. MassSupport provides free community outreach. 1-1. Our support service, this is what we do. It's group services available for families, adults, children, youth, and employees and communities. We have educational presentations on traumatic stress and resilience building. We have coalition building and engagement. And then we have collaborative work and agencies, schools, coalitions to provide support and consultations to everybody in the state of Massachusetts. In other words, we're here to serve you. Give us that opportunity. And I'm telling you one thing, we're going to serve you in love. This is you see our logo there, MassSupport, that serves the Riverside Trauma Center. Our Twitter handle at MassSupport /.org. And then we got the Facebook. Also, we got MassSupport. You see our email address there and our phone number. We're here for you. I want to say thank you to everyone that came out to this town hall today. We appreciate you. Thank you for caring enough for yourself to come out and check out how we can be of greater service to you. And I want you to know this is just the beginning of us reaching out and being a help to you. Thank you very much. Have a great night.